The ECG, the electrocardiography of the heart, is represented by letters using from P up to T, that is P, Q, R, S, T. It has three components. We can see the P part represents the contraction of both the atria. The second complex, the QRS, first part is P, second part is QRS, and the third part is T. So QRS represents the systole of the ventricles, यानी कि पहले दोनों एट्रिया कंप्रेस होंगे, उसके बाद we'll come to the lower chamber, the right and the left ventricle, the both will be compressed here, and then the relaxation of the ventricles. पहले दोनों एट्रिया कंप्रेस होंगे, दैट इज एट्रियल सिस्टोल, उसके बाद वेंट्रिकुलर सिस्टोल, एंड उसके बाद रिलैक्सेशन ऑफ द वेंट्रिकल्स, दैट इज डायस्टोल. और यहाँ पे हमारा एट्रिया कंप्रेस होने के बाद, वेंट्रिकल्स कंप्रेस होने के बाद, एंड देन वेंट्रिकल रिलैक्स होने के बाद, ये हमारा एक साइकिल हमारी कंप्लीट हो जाएगी. एंड देन दिस विल बी रिपीटेड अगेन. बोथ द एट्रियम विल कंप्रेस, the blood will pass to both the ventricles, and then they will compress, and the blood will be pushed to whole of the body via aorta, and then the relaxation of the ventricles. So that is the one cardiac cycle of the ECG. So in a minute there are 72 cycles, because one cardiac cycle consists of 0.8 second, and when we see there are 72 cycles in a minute, so that accounts for एक cardiac cycle में 70 ml push होता है, and when we multiply it to 72, it turns out to be 5200 ml, that is close to 55.2 liter. So you can also see here the P wave represents the electrical excitation or depolarization of the atria, which leads to contraction of both the atria. The QRS complex represents the depolarization of the ventricles, which initiates ventricular contraction. The contraction starts shortly after Q and marks the beginning of the systole. So the word that have been used here are excitation or depolarization of the atria, while for the QRS they have used the words depolarization of the ventricles. So first depolarization of the atria, and then depolarization of the ventricles. And then in the T, first is related to the atria, and second part QRS is related to the ventricles, and then third part again is related to the ventricles. That is the T wave represents the return of the ventricles from excited to normal state, that is repolarization. Here depolarization, and here it is repolarization. The end of the T wave marks the end of the systole, यानी कि वो अब relaxed state में आ जाएगा, and then the cycle will go again to the this P wave. Right, and there are some few more you can see here. Some more points related to this topic are that human heart is derived from embryonic mesoderm. It is myogenic and not neurogenic. And to talk about the regulation of the cardiac activity, the regulation takes place by medulla oblongata, that is the lowermost part of the hindbrain. Right, so medulla oblongata moderates the heart function, cardiac activity through the autonomic neural system, which controls the involuntary part or the visceral organ. तो यहाँ पे autonomic neural system heart को regulate करता है via two activities, that is sympathetic nerves and parasympathetic nerves. Sympathetic nerves कैसे काम करती हैं? They work or they function by increasing the heartbeat. Right, so what they do is they increase the ventricular contraction. Right, they increase its intensity, so heartbeat or the cardiac output or the blood pumped out through the ventricles increases, and by the parasympathetic nerves the opposite takes place. If you have to calm down, then the heartbeat comes down or the cardiac output also comes down. So besides this the neural functions, it is also controlled by the hormones. The hormones that controls is the adrenal medullary hormones, which are epinephrine and norepinephrine, steroidal hormones, So what they do is they increase the cardiac output, right? And I have already explained this part. So, and the last part is during the each cardiac cycle, the lub sound, that is two sounds are produced, lub sound and the dub sound, right? So lub sound relates to the closure of the tricuspid and the bicuspid valve, right? Bicuspid valve is also known as your mitral valve, and the second sound, dub sound, that relates to closure of the semilunar valves, right? So when we hear the when you place a stethoscope, right, on a patient's heart, we get to hear these two sounds, lub sound and dub sound. So they are associated, or they correspond to the closure of these two particular valves, right? Thank you.